The first thing we need to look at is what exactly is depression and the effect it has on the brain. Depression, also known as major depressive disorder, is a mood disorder that affects someone's daily living, as well as how you think and feel every day. It is the most common mental disorder in the United States, and there are over 264 million people worldwide who suffer from it. It is thought to be caused by any number of factors. Depression is treatable and can be treated in a number of ways, including antidepressants. Antidepressants work by helping the brain to control and use chemicals that affect your mood and stress in the right way. There is a pretty important relationship between the way someone feels and what they eat. Your brain gets many signals and nutrients from the food you eat, and what you are putting into your body really does matter. There have been many studies in which they show that many people who suffer from depression show low levels of vitamin B, specifically vitamin B3, B6, and B12. The rates of depression differed in men and women, by women being almost 2 times more likely to suffer from depression. This is the result of many different factors, where there is a difference between men and women, but there was one interesting study that showed a difference in the specific B vitamin each gender had a deficiency in when related to depression. Depression was seen to rise in men who were getting less folate, which is also known as vitamin B9, and depression was seen to rise in women who were getting less vitamin B12. Both B9 vitamins and B12 vitamins are shown in great quantities in the Mediterranean diet, which I will talk about later. Having low levels of vitamin B12 and B6 specifically can lead to a buildup of homocytosine, also known as hyperhomocytinemia. Homocytosine is an amino acid that is made when proteins are broken down and are then converted to cytosine. Vitamin B12, B6, and folate are responsible for this conversion, and when you are low in these specific vitamins, this conversion is impaired or damaged. This buildup affects your neurotransmitters and has an effect on aspartate glutamate receptors in the central nervous system, which affects mood. Making sure you have good levels of vitamin B is a great and important way to aid and help in avoiding depression, but once you have depression, just raising your B vitamin intake won't always do the trick. People develop depression for many other reasons, including many different factors. When talking about B vitamin's role, once a patient already is diagnosed with depression, there is more the vitamin can do than you think. A study showed that once diagnosed with depressive disorder and B vitamins were taken, they did not have an immediate or short-term effect on depression, but instead showed that they can reduce the risk of relapsing later on and also show that they can help sustain your response to antidepressants. A study was done that took a group of people with depression and varying symptoms that they measured using the Montgomery-Åsberg Depression Rating Scale, known as MADRS, and gave 76 patients a placebo and 77 patients the vitamins. They watched these patients over a 52-week period, remeasuring their symptoms in response to antidepressants at the 12-week mark, 26-week mark, and then 52-week mark. The results showed that these B vitamins enhanced and sustained the response to the antidepressant within those patients. The Mediterranean diet is a diet that got its start around the 1960s and was the normal diet of people in the Mediterranean, such as countries like Italy, Greece, France, and Spain, but is now eaten all over the world. It is mostly known for preventing heart attacks along with strokes and many other health issues like type 2 diabetes. This diet consists of eating fruit, vegetables, whole grains, potatoes, bread, legumes, nuts, seeds, herbs, spices, seafood, which is most notably fish and olive oil. No red meat or any animal meat is eaten except fish, which is filled with omega-3 fatty acids and B vitamins. It was also shown that people who don't get enough omega-3 fatty acids will also have higher rates of developing major depressive disorder. Many of these foods and vitamins we need on the daily are vitamins that cannot be synthesized by our body, and thus we need to consume these certain foods to give our body the right nutrients. B vitamins are among those vitamins that we need to get through our diet. Going back to the study about there being a rise in depression with men with low vitamin B9 levels and women with low B12 levels, the Mediterranean diet has high levels of both vitamins. Folate can be found in foods such as legumes, nuts, fruits, and some vegetables. Vitamin B12 can be found in fish and low-fat dairy products. When talking about ways to help and cure depression, an important question to consider is what group of people have the lowest depression rates, and what may these people be doing differently compared to groups with the highest depression rates. Some of these lowest depression rates were among those who followed this diet, being the Mediterranean diet. There was a study done where they took 10,094 adults and collected information on each one regarding the food they ate on a daily basis. After about 4.5 years, they followed up and reassessed the same adults, and in the group, there were now 480 new cases of depression amongst them. The researchers took this information and compared it to each of the adults' diets, in ones which had depression as well as those who didn't. The outcome of the study showed that those individuals who most closely followed the Mediterranean diet were 30% less likely to develop depression than those who didn't follow the diet. With this information, it makes you wonder what in the diet specifically helped with depression, and what is in it that is superior in helping with depression that is different than other diets. The answer would be B vitamins. Depression is also seen to be caused by various health issues. Following the Mediterranean diet gives you all the B vitamins needed and helps with heart health and can lessen your overall risk of various health issues. All of this together prevents and aids in depression, recovery, and overall health, so it is highly recommended that following this diet will improve depression in more than one way.